injury and cell death. In Section 1, we're going to talk about patterns of cellular response to stress. Cells are active participants in their environment. They constantly adjust their structure and function to accommodate changing demands of extracellular stresses. This is the relationship between normal cell, adapted cell, and injured cell. Normally, cells maintain homeostasis. When they encounter physiologic stress or pathological stimuli, they can undergo adaptation, achieving a new steady state and preserving viability and function. The adapted cell include hypertrophy, hyperplasia, atrophy, metaplasia. Once the physiologic stress and pathological stimuli are gone, the cells can recover to normal state. If the stresses exceed the cell's adaptive capacity or the external stress is inherently harmful, then cell injury develops. Cell injury includes reversible and irreversible injury. With certain limits, injury is reversible. Cells return to a stable baseline. We call it degeneration. However, severe or persistent stress result in irreversible injury and cell death. Whether a specific form of stress induces adaptation, degeneration, or cell death depends not only on the nature and severity of the stress, but also on several other variables. They are cellular metabolism, blood supply, and nutritional status. This picture is a good example to illustrate the relationship between normal, adapted, reversibly injured, and dead myocyte. The cell in the middle is normal myocyte. We know that heart works as a pump. When the blood pressure increases, the workload of myocyte increases too. The normal myocyte will turn into adapted myocyte. It undergoes hypertrophy. That's what happened in the patient with hypertension. We notice in the first picture here, the cardiac wall is obviously thickened. The hypertension persisted. The enlargement of myocyte can no longer compensate for the increased burden. Then a limit is reached. The reversible injury occurred. And once the blood supply was shut down because of, for example, the atherosclerosis, it leads to complete ischemia and cell death, like here. Analysis of cellular and tissue responses to injury is the core of pathology, because cells and organs respond to insults in a relatively stereotyped way. These responses can help us to trace the cause or nature of injury in many cases. Tissues and organs can also undergo adaptive change that are coordinated to manage internal or environmental stresses, such as the alteration in heart rate or blood pressure. The mechanisms include cell-to-cell interaction, paracrine signal, hormonal signal, and neuron signaling. So far, we have learned the relationship between normal cell, adapted cell, and injured cell. In the next section, we will discuss cell adaptation in detail.